is for the joint work between us as Chorlton Good Neighbours and the nursing team, who we may know as the active case managers or the community matrons, but to us they're Janet, Gilly and Lisa on the Thursday mornings. But can I welcome some guests here first? Gaye Jackson on the end is the Programme Manager for Health Education Northwest. I think I've got that right. And she's going to present the certificate in a few minutes. So welcome, Gaye. Thank you for coming. Kathy Hearne, who's head of the integrated teams, is that right? Yes, good. And Sue Ware, who's the lead nurse for community services. Welcome, Kathy and Sue. Thank you for giving up your time. We know how busy you are this morning. And of course, welcome to Janet and Gilly. And Lisa would have been here with us, but she's heading off to Glastonbury. So hopefully she's got her welly boots. Rather her than me, I say, don't you? So if we think about the background to why the clinic was set up in the first place, basically it's been part of a bigger approach to improving communication between ourselves as Chorlton Good Neighbours and local health colleagues. I know that often volunteers are the first people who will notice a change in someone because they see an older person in many different situations. So when they spot a small change and it concerns them, they will monitor that for so long and then they will raise it with me as a genuine concern. So with all that in mind, at the end of last year, we decided to have a go at doing this nurse pilot on a Thursday morning. Now, as you know, this nurse clinic has been an amazing success. I think it's been quite transformational for both parties to see how such a project could work. What's coming across to me from yourselves and from the volunteers is that the nurse, Janet, gives you more time, she gives you more detailed explanations. Quite often you're approaching Janet instead of bothering the GP. Quite often you think this is for minor issues, but as we know, sometimes the minor issues can turn into something important. So Janet does follow-up actions for you. She helps you get appointments where you need it, and I think now's the time, if you could join with me to give a very big thank you to Janet, because she's the best. In a way, it's the way forward, isn't it? To bring services where possible on site to you and to us. I mean, nobody's suggesting that next week we're going to be doing brain surgery in the kitchen, although Peter might like to have a go at that. But it is the way forward, I think, where possible, that clinicians could come on site into a venue that's non-threatening, it's comfortable, you know you've got the support of volunteers and staff here, and yes, definitely I feel it is the way forward. So thank you everyone for contributing to the success of it. Thank you.
No, I think since we've had this, I think we've kept a lot of people out of hospital.
I woke up one Thursday morning and I got a very sore toe. For some reason it had come up in the night, it was like a tomato and red. So just by chance, the nurses were here, so I went in and said, what can I do with this? Before I could move, it took me blood pressure. Jilly had been on to the doctors, to the surgery, to find out what my medication was. And before I went home, I had got a prescription. Wow. So the very next, I went home, got my medicine, I started the same day with the antibiotics.
For getting these people in, and especially for Janet. She's been an absolute diamond. Whenever I don't feel well, I know I can pick the phone up and talk to Janet, and she always puts me right. And I'm very, very grateful for it. Thank you very, very much.
myself, I have a lot of health problems, and like I find, you know, how you find it difficult sometimes. But when I come to a group like this, it helps me to forget, because I can suffer depression as well. I know, like you said, you know, you can go in hospital, because I used to get like that, but now I'm a lot more better and positive, and, you know, I just try and keep going if I can, and just try and do what I can. But like, you know, what you said about, you know, getting in touch, because I have trouble sometimes trying to get medication. So it's good that, you know, we've got somewhere else to go. So we'll appreciate it, won't we, everyone?
Yeah.
So, yeah.
Janet is the face of the clinic. I think we chose wisely, don't you? I think it's fabulous. Our service is about that prevention, preventing hospital admissions and deterioration, and we've done that. We work with people with acute situations, from more complicated big toes to less complicated stuff. And we also work with people on end of life and thinking head decisions, and with carers, which you all are. And I just want to thank you, I really appreciate. And thanks for our team leaders coming, the purse holders, that's good, and from Education North West, that's good, thank you.
Health Education North West, you probably don't even know it exists. It is the organisation that commissions and pays for all the training for all the healthcare staff across the North West. But the award and the runners-up award that the project has won is about integrated working. And I think we've mentioned about how important it is for us all to work together. It doesn't matter whether you're employed by health, by care, you're a voluntary sector, you're a social enterprise. We should all be providing joined up service instead of having gaps here, there and everywhere. And this project definitely fit that bill for me. It's an example of really good practice, and I hope it's something that can be replicated across the North West. We do tend to be very medical model, but we're looking at what we call, and you might not, call social prescribing. I noticed that you have a garden. Gardening is now known to be absolutely beneficial to physical and mental health in individuals. Choirs, excellent for anybody with a chest condition or just to participate in. We're just beginning to catch up to you guys now. So I may well be back in touch with you to, you know, learn from you, and that's what it's all about. Congratulations. So who's going to, do you want to have it in the middle there?